Hi, everybody. This is Dr. Traci Nelson at Nelson Chiropractic, and I just wanted to take some time and talk to you about the new therapy that we're adding in our office. We're super excited about it. It's going to be an amazing addition to our arsenal of tools to help our patients. And so I wanted to bring in the expert on red light therapy, Dr. Neil, to talk about everything that we need to know about it, what questions you didn't even know you had. So I'm going to let Dr. Neil introduce himself.
Thank you, Dr. Traci. I'm so excited and honored to be here. And first, before we begin, I wanted to congratulate you on offering this life-changing technology and the very best to your patients and your community. It's obvious that you love and you care for your community with offering the very best. Let me tell you a little bit about myself. I graduated from Life University in 2000. I got my chiropractic degree back then, practicing for the past 25 years. In that time, created an anti-inflammatory 60-day program called True Weight Solutions. Prior to that, I went to NC State and I double majored in biochemistry, chemistry, and minored in genetics. So I was a big Krebs cycle nerd back then. Everyone remembers that from high school biology. So, and then I got into something called photobiomodulation, which is energy medicine, light medicine. It's how the cells in the body interact with different frequencies in sunlight or regular light. So, got into that back in 2014. The technology has since then improved by leaps and bounds over the last 12 years, and so we have the very latest technology, and so we created Renu Light systems because of that. What red light does, or what photon energy does for a cell, so it stimulates things called mitochondria in the cell, and every one of our cells has these they're called little engines of the cell.
Powerhouses, yes.
Yeah, they produce something called ATP, which is part of that Krebs cycle nerd stuff I was talking about that I love so very much. So ATP is the currency of the body, if you want to think of it as energy currency. So we need ATP to function, period. So
everybody wants more. We all need more.
Yeah. And right now, at this point, we're at a very low. There's something called mitochondrial dysfunction. So there's research out there talking about as we get these toxins, that the body suffers stress physically, chemically, and even mentally, emotionally. And so, our job is to optimize the body to heal from the inside out.
Absolutely. Yeah.
That's what we do. And I always tell everyone, all my doctors, if I were to offer just one program in my office, this would be it. It's so versatile. And so it's easier to tell you what it doesn't help than what it helps.
Yeah. Tell us the major uses. If people maybe hear about red light therapy, what do they first think it's for? And what are some little known uses or benefits?
Sure. So what we've done, we've included 4 wavelengths of light. Okay, 2 red light, that's where the term red light comes from. Those are visible to the naked eye. So, Roy G. Bibb, do you remember learning that in elementary school? So the rainbow colors, those are all visible spectrum. So 600 is the highest on that spectrum. And so they're very surface. And so where red light got its start was body shaping, contouring, weight loss, and that's all it was used for back in the day. Now there's infrared frequencies. Now those are invisible to the naked eye, but those are higher. So 800, 900 frequencies. And just so people know, like class 4 medical lasers go into the thousands. And these are safe. They're harmless, very little contraindications. But what happens is, because of the range of frequencies we have in these Renu pods, we can help a very wide range of conditions. So I have all of my doctors use all 4 wavelengths all the time. It's called a biotunnel. So what they'll do is the patient will get into the pod, and they'll be surrounded 360 degrees. It's about a 10 to 15 minute treatment time, very comfortable. And they're going to get bathed in these wavelengths that are biologically optimized. So these are the wavelengths that your cells will respond to the best. So they're going to get all of it. And there's research out there, mental health. So it helps with depression, anxiety. We're talking, skin conditions, just about anything. And what I tell my doctors is, okay, your patient may come in with XYZ, but they're going to start just feeling better. They're going to start sleeping better. They're going to start having more energy. They're going to feel happier because all of the dopamine and serotonin and all these chemicals that the brain produces are going to get balanced again. And
you get all the benefits regardless of your intention on using it.
Right. That's what I love about it. It's a very, I personally felt guilty in my office not putting a patient on this therapy, at least including it as part of their program.
Sure.
Because I knew that their outcome was going to be so much better.
Yeah.
Utilizing all the different
sleep is a huge issue with people.
Huge.
Such a huge issue. Huge. With healing and everything.
And so what these programs do is create an anti-inflammatory effect. So a lot of us, I don't know about you, but I had a lot of fun in college, and so I'm 54. I give these seminars and I kind of joke around and I say I'm 94. but I had a lot of fun, and I ate whatever I wanted, did whatever I wanted, and
got toxic.
And then over time and now I'm spending time anti-aging. I'm trying to age backwards as best I can, and that's what we all try to do. It's called longevity medicine, or it's what anti-aging medicine was called. Now it's longevity medicine.
Right.
But we want to extend our life, and I used to give a seminar calling live younger and stronger for longer. So we all want to age gracefully, but we still want to do the things we want to do.
Absolutely.
So my brain goes, hey, I'm 25. My body's like, no, you're not. And I'm trying to do things to help my healing process, and that includes all of this.
So talk about pain relief. What kind of conditions or what kind of pain relief can it provide?
I can tell you. So I used it for everything. We treated disc conditions, decompression patients, sciatica, just mechanical back pain. So pain is a result of an inflammation that occurs. So everyone knows they get hurt and they say, okay, ice it for the next 2 or 3 days right away after a trauma. But long-term chronic pain is a long-term chronic inflammation.
Yeah.
And so that's where this shines, is you put them in, and this starts to control and reduce all the inflammation in the body. And I used to say it's like we're living like California brush fires inside. So that's where, COVID had a field day, because it didn't matter if you were diabetic, obese, skinny. We just didn't know who it was going to affect. And that's because all of us have these brush fires going on, and our immune system are the firemen. They are too spread out. They don't know where to go because it's systemic. So that's why I love this. It's a system-wide treatment. It hits the whole body.
Everything that we've been doing over the past year in our office is, we are just at war with inflammation nutritionally and with all the services we're providing. And this is really like the capstone of all the things we've been doing over the past year. So we're super excited to add this. I think patients are going to benefit so much. It's the most exciting thing that we've done. But tell us how it works. We get there, and what do they wear? Do they wear goggles, like an old school tanning bed? How long does it last? Talk about that.
Yeah, we do provide eyewear, and the eyewear is just to keep the person from just staring at the top and the lights.
So for comfort.
Yeah.
The brightness.
The wavelengths are going to penetrate anyway. There's a lot of research and data on. I get excited about this stuff, but mitochondrial dysfunction in the eyes, macular degeneration. There's reports of, hey, I did have fuzzy eyesight. Now it's, I did a session. I'm seeing a little better now. Can't make those claims, but there's a lot of data out there in Europe about this. there is white paper data on diabetes. So I used to have a lot of patients with neuropathy being put into this capsule, but
yeah, there's a lot of studies about diabetes being inflammatory, so it makes sense.
Oh,
There's
100%.
Sure.
It's diabetes is like pouring kerosene on the brush fire. So we've already got a brush fire happening. Now you have a diabetic. Well, guess what? That's pouring gasoline on it. So, but they were talking about the beta cells in the pancreas getting dysfunctional, the mitochondria in the beta cells, and so we've created diabetic protocols, neuropathy protocols. There was a couple in Nashville that him and I sat down, one of the doctors and I sat down and created a Lyme's disease protocol. So there are, like I said, there's a few handful of things. Active cancer should not use this on. We don't want to stimulate cancer.
Sure. Is there any other contraindications or people that should not use it?
Lupus seems to be contraindicated.
Okay.
Other autoimmune diseases, perfect, no problem.
Okay.
But we've seen lupus and we've seen cancers, and then obviously active pregnancies.
Yeah.
I personally believe that it would help even pregnant women. However, there's, you have a little bambino in there, so we want to be extra cautious. So for
sure. Okay, so they come in and they wear. What do they wear? Tell them about that.
Yep. Sorry, I get really excited about talking about this stuff, so I get on a tangent. But so we tell the women they can wear bra and underwear, or they can wear just like spandex. Okay. Like a sports bra and shorts. Men can go down to underwear or shorts, gym shorts, and that's fine. We would like to see as much skin exposure as possible to absorb all the energy. So.
Of course. Okay. And then how long can they expect to be in treatment?
Yep, it's up to a 15-minute treatment time, so it's very efficient.
Very quick.
People think more is better, and that's not the case. You can overexpose, so we have specific protocols. I do want to impart that this is a clinical grade unit.
Yeah, we didn't talk about that. Yeah, talk about that. What's the difference between this and what someone might do at home with a light pad or something?
Right, exactly. So there's a lot of red lights everywhere right now. You can go to your gym and find red light. You can go to Amazon and find red light there and have it. I need everyone to understand that those are not clinical grade. They're considered consumer grade. So they don't produce enough light energy or photon energy to have a clinical outcome. So that's why most treatments are going to be two times a week. Yeah. That's enough to get the energy into the tissue, the light energy. And I like to liken this to, say, taking a vitamin D supplement. So the photon energy does concentrate in the tissue. So each treatment builds on the last one. Now, on a consumer grade, they can't make them that powerful because they don't want people to hurt themselves. So that's why we only sell to physicians, to healthcare practices, because we want to monitor, we want specific clinical protocols to be followed, because we want the patient to do the best clinical outcome. If you stay in a bed like this and it's too long, you can overtreat and have a reverse effect. Same thing at home. If you have an hour a day, every day, to stand in front of your unit, you may get a little bit of an effect, but it won't be a long-term effect. Now, I'm of the mindset that it's like taking supplements at home. Although you only absorb 20% of that supplement, it's better than not doing anything.
Sure.
But if you have a choice and you can come in and you get this type of medical grade treatment, the outcomes are amazing, and you'll soon find out. You'll soon see yourself.
Super excited. Last question, very last thing, and then we'll wrap it up. I know this has been a minute, but talk about we see a lot of young athletes in our house even, but talk about like teenagers and young athletes using this technology. What benefits would they receive?
And young people heal amazingly quick anyway. You're talking about supercharging that. So when I talk to most doctors, a lot of them are in sports medicine. One was a triathlon athlete herself, and so she was she was saying that runners and athletes always look for ways to cut down their healing time. Like they want to heal and get back out their plan. This is it. This speeds the repair process in muscles, in joints, ligaments, tendons, hairs even will help.
Awesome.
There's protocols for that too, and that's what we provide. We help these doctors with clinical protocols to make sure they're optimizing their patient's healing ability, and that's really what it's about. It's about optimizing their own bodies, getting them healthier, living better, doing the things they really want to do and enjoy. So
absolutely. We didn't even talk about the cosmetic benefits.
Yeah. So
we need all day, but
so in the 600 frequencies, that's where this all started, right? NASA even actually helped develop this way back in the 80s, and it's coming back around again. There's a boom about red light and anti-aging and longevity, I guess they call it. But so the surface red wavelengths will help with collagen production, fibrin production, connective tissue. You're talking about getting rid of wrinkles. Here's a really good one, cellulite. So it will help with cellulite. It'll help with weight loss with using. So we developed a 60-day anti-inflammatory with this. Not to mention, on average, 20 to 40 pounds of weight loss in about 8 weeks, 60 days. It's non-starvation. It's got sublingual or under the tongue drops. So patients would come in and they were like, well, I don't like taking pills. That's why I'm here. And then I listened. And so as a biochemist, I was like, how do we produce these formulas? And the second best delivery system is under the tongue.
Yes.
The first best is an IV or an injection, right? But the second best is 80% absorption is under the tongue. You take a supplement, like I said, it's 80% expensive pee and poop.
Yeah.
But to be medical about that, those are medical terms.
You said poop, it's fine.
But we wanted the highest absorption rate. So it's 80% absorption taken under the tongue. So very simple to follow, and you combine the two technologies together, the outcome is fantastic.
We're so excited about that.
Yeah.
So excited about that.
Yep.
Awesome. Well, thank you so much for your time, and I am certain this is going to help so many people, and we look forward to giving you updates about how everyone's doing.
Oh, I can't wait to hear how your patients do. We know they'll do well. So
yeah, thank you so much. Have a good day.
Yes, take care.